The morning Elara Quinn got called a liability to her face. In front of the entire trauma bay, she didn't cry. She wanted to. God, she wanted to. But she'd learned a long time ago, somewhere between her second tour in Kandahar and her third, when crying meant your hands shook during a field amputation, that some things you just swallowed down and got on with. It was a Tuesday, the kind of gray, damp Tuesday that only southwestern Ontario can produce in November, where the sky looks like wet concrete and the cold gets into your bones before you've even made it from the parking lot to the entrance. Elara had arrived at Lakeridge Regional Medical Center at 05:45, which was 45 minutes before her shift technically started, because the overnight nurse had left a note that Bay 4 had a post-op who'd been restless all night, and Elara wanted to check on him herself before the chaos of morning rounds. She walked with a slight drag in her left leg, had done for 3 years now. Most days she barely thought about it. Most days. She'd pulled her hair back, clipped her ID badge to her scrubs. Elara Quinn, RN, Trauma Unit. Poured herself a coffee from the break room that tasted like it had been brewed sometime during the Harper administration, and was reviewing the overnight chart when Dr. Frederick Holbrook walked in. Holbrook was the kind of doctor who announced himself with a room temperature drop. He was 61, had trained at McGill, and carried his credentials around like a shield. He was tall and silver-haired, and spoke to nurses the way a person speaks to a parking meter. Not unpleasant, exactly, just completely convinced the interaction was going one direction. He didn't even look at her when he started talking. He was flipping through a chart, eyes down. Quinn. The Morrison consult. I need the notes pulled and prepped for rounds at 7. Already on your station, Dr. Holbrook. The bilaterals from yesterday? Radiology flagged the left lower lobe. I left a note. He flipped a page. The Okonkwo patient. What's his status? Stable, but he had a rough night. His oxygen sat was dipping. I'd recommend we push the review up. He might need. I'll determine what he needs. He finally looked up. That's not a clinical recommendation I asked for. She held his gaze. I know. I'm offering it as the nurse who's been monitoring him for 16 hours. Something shifted in his expression. Not rage, something worse. Dismissal. Quinn. He set the chart down. How long have you been on trauma? Coming up on 2 years here. 8 years total counting deployment with the RCAF as a medical technician. The sound he made wasn't agreement or acknowledgement. It was a kind of professional shrug. So you have field experience? Yes. In a field setting, he picked up his coffee. We're not in a field setting. We're in a tertiary care facility with established protocols and a team of attending physicians who manage clinical decisions. Your role here is to observe, document, and report. He looked at her leg, just briefly, just enough for both of them to know he'd done it. I understand there are certain limitations we're working around, but I need to be honest with you because it's more useful than not. There are members of this team who've raised concerns about whether trauma is the right fit. The break room had gone very quiet. 2 nurses near the coffee station had stopped moving. Elara felt the color climb her neck but kept her voice even. Are those concerns documented? This isn't that kind of conversation. Then I'm not sure what kind of conversation it is. Holbrook picked up the chart again. Rounds at 7. Morrison notes, please, not your editorial additions. He left. For a long moment, Elara stood with both hands wrapped around her terrible coffee and stared at the doorway he'd walked through. The 2 nurses at the station were very carefully looking at their screens. One of them, young, third month on the unit, a girl named Tatum, who reminded Elara of herself at 24 in ways that were sometimes painful to look at, caught her eye and gave her a look that said, "I'm sorry, that was awful," which was its own kind of exhaustion. Elara set down her coffee, went back to Bay 4, checked on her patient, who was sleeping better now, whose oxygen had stabilized, whose chart she updated with careful, neutral language that did not include the words "I told you so" anywhere, not even in the margins. She had 3 more hours before that would matter. It was 6 weeks earlier that Elara had almost lost a patient named Gerald Korhonen. Korhonen was 73, a retired mill foreman from Sudbury, and he'd been brought in with what his family physician had coded as a probable cardiac event. He'd been stable when he arrived, confused but calm, and the attending on call, not Holbrook, a younger doctor named Rice, had ordered the standard workup and settled him into observing. Elara had been doing her rounds when she noticed something. It wasn't one thing, exactly. It was the particular constellation of things that her brain had learned to recognize in places where there wasn't time to recognize slowly. The way he was breathing, the pattern of his confusion, the subtle edema in the wrong place. She'd gone to find Rice and told him what she was seeing. Rice had been polite. That was the thing. He'd been genuinely polite, had listened, had said "thank you, I'll note it," and then had not changed anything about the order set. An hour later, Korhonen crashed. The rapid response team had gotten there in time, by millimeters. Afterward, in the debrief, Elara had raised it carefully and professionally. The early signs had been there. The intervention window had been there. Rice had been equally careful and professional in his response, which was that the symptom presentation had been ambiguous, and he'd made a reasonable clinical decision based on available data. She hadn't pushed. She hadn't known, at that point, how much it would cost her not to. But Holbrook had been in the debrief, and something about the way he'd looked at her afterward, at her, specifically, not at Rice, told her that she'd been categorized, filed somewhere. The nurse with opinions, the nurse with the limp. She'd heard what people said, sometimes, when they thought she wasn't nearby. Not often, not everyone, but enough that she'd been medically released from the RCAF after her 3rd tour. That she'd come back from Afghanistan with a leg injury that had ended her service career. That she'd retrained as a civilian RN, restarted, some people called it, as if her previous decade had been a rough draft, and that she was good at the work, genuinely good, but that there was a question of fit. What no one said out loud was the thing underneath all of it, that they weren't sure they trusted a nurse who'd seen war, who'd made the kinds of calls you make in the field when there's no attending, to defer to who'd been the most qualified person in the room so many times that the habit of knowing it was baked into her now like marrow. That was, apparently, a problem. The morning everything changed began the same way as the bad Tuesday, only worse. It was a Wednesday in late January. There was a freezing rain advisory for most of southern Ontario. Elara had driven in on roads that felt like suggestions, had arrived to a department that was already running 4 patients short of capacity before 0Z700, and had been on her feet continuously since she'd walked in. By noon, the trauma bay was full. By 1300, they had a multi-vehicle accident off the 401 feeding patients in, and the department was loud with the specific frequency of controlled panic that Elara had spent years learning to work inside. She was with a woman named Mrs. Adeyemi, 50s, passenger in the accident, conscious but deteriorating when she noticed it. Abdominal guarding, a particular kind of restlessness. a BP reading that was technically within range, but trending in a direction that had a voice in Elara's memory. And the voice was saying, "This is not stable. This is not stable." She found Holbrook at the nursing station. "Mrs. Adeyemi in Bay 2, she said. "I need you to look at her. I'm in the middle of. Her pressure is dropping. The trajectory is wrong. She's guarding. I think there's internal bleeding we're missing." Holbrook didn't look up. Her last set of vitals were unremarkable. The last set. The trend over the past 20 minutes is Quinn. He finally looked at her. There was something in his expression that was almost tired. "You flagged Coronan. You flagged Morrison. You come to me 3-4 times a shift with concerns. At some point, the frequency itself becomes a signal." The air between them felt like January outside. "What kind of signal?" she said quietly. "That perhaps your experience, the experience you have, is making you see patterns that aren't there." He paused. "It's a known phenomenon. Field medics sometimes struggle to recalibrate. The threat level is different here." She looked at him for a long moment. "She's going to crash," she said. "I'd like it on record that I flagged it, noted." He turned back to his chart. She walked back to Bay 2. Mrs. Adeyemi looked at her when she came in, and her eyes were doing the thing that eyes do sometimes, that particular effort of focus that means a person is working very hard to stay on the surface of consciousness. "You're going to be okay," Elara told her, which was both a comfort and a prayer. She took her vitals, updated the chart, positioned herself so she could see the bay monitor from the hallway, waited. 14 minutes later, Mrs. Adeyemi's pressure dropped 22 points in 6 minutes. The code team got there fast. Elara was already there. She did what she was trained to do, what 12 years of doing had made her able to do without thinking, smoothly, automatically. Her hands knowing where to go even, while part of her brain was somewhere far away, somewhere flat and hot and loud, remembering the last time she'd watched someone fight this hard to stay. Mrs. Adeyemi survived. She went to emergency surgery and survived. Holbrook did not look at Elara once during the code. Afterward, when the bay had been cleared and reset, and the paperwork was beginning its mountain building project, Tatum found Elara in the supply corridor doing nothing, just standing with her back against the shelving, eyes closed. "That was incredible," Tatum said. "You saved her. The team saved her. You flagged it before anyone else saw it." Elara opened her eyes. "Tatum, go finish your charting." "Okay, but are you? Go finish your charting." She stood alone in the supply corridor for another 2 minutes. Then she straightened, rolled her left shoulder the way she always did when the leg started aching, and went back to work. She was at the nursing station at 15:47, finishing her documentation when she heard it. Everyone heard it at the same moment. The sound was unmistakable, multiple rotor systems, heavy, in close formation, and getting closer. Fast. Someone at the window said, "What the?" Elara was already moving. The hospital's helipad was a single-pad rooftop structure. They used it for air ambulance transfers, occasionally for Coast Guard medical evacuals, twice in the past year for military medevac patients from CFB Borden. One helicopter at a time. She reached the window at the end of the corridor and looked out. 4 helicopters. Military, CH-146 Griffins. She knew the profile without having to think about it. The shape was in her somewhere, in close formation, descending toward the hospital campus, in a way that was most definitely not landing on the rooftop pad. 2 of them were peeling off toward the parking structure's upper level. 1 was hovering. 1 was already down on the road in front of the hospital, which was, technically a controlled access route and not a landing zone, which meant someone had cleared it in the past few minutes without telling the charge desk. The radio at the nursing station crackled. Someone from administration, voice tight. "Trauma, heads up, we have incoming from Canadian forces. Priority evac. They are requesting a contact in your department. Stand by." Holbrook was at the station now. So was the charge nurse, Bernadette, who had run trauma for 11 years and had the calm of a person who'd seen most things. Even Bernadette's face had an expression on it that was slightly different from usual. "Who are they requesting?" Bernadette asked. The radio gave them static then. "Name they've given is Nightingale Actual. Is there anyone on your team?" Elara went very still. She hadn't heard that designation in 3 years. She hadn't heard it since the last time a CF-18 pilot had been pulled out of a valley in Kandahar, with wounds that shouldn't have allowed him to be alive, and she'd been the reason he was. She had not told anyone here. Not her supervisor, not Bernadette, not Tatum. It was not on her CV because it was classified, and because she hadn't thought it would be relevant, and because some things you carry around in places you don't talk about. Nightingale, Actual. The name they'd given her in the field when she'd been the senior medical technician on the joint Canadian-NATO medical support team. When she'd been the one people called. Not because she was the closest, not because she was the most senior officer, but because she was the one who didn't lose people. She exhaled. "That's me," she said. The radio went quiet. Bernadette turned to look at her. Holbrook turned to look at her. Half the nursing station turned to look at her. "I'm sorry," Bernadette said. "Nightingale Actual." Elara clipped her badge straight. Habit, the way she'd straightened her uniform before walking into any briefing. "They're asking for me." She walked out the front entrance of Lakeridge Regional Medical Center at 15:53. The Griffin on the access road had powered down its rotors to idle. 3 personnel were on the ground. 2 in full CF combat dress, rifles slung, and 1 in flight suit, no cover, who Elara recognized immediately. Colonel James Whitmore, flight surgeon. She'd served 2 months alongside him during her second tour, before he'd been promoted up and out of field deployment. He was somewhere in his early 50s now, and his hair had gone entirely gray. And his face when he saw her did the thing faces do when relief is too big to be dignified. He crossed the distance between them in about 4 strides. "Quinn." "Sir, we've got a situation." He'd clearly been briefed to be efficient. She could see the effort of it. "Sergeant Major Tran Min Duke. He was in a training accident at Meaford this morning. Convoy rollover, not combat. He was training reservists. He's got a TBI, possible cervical injury, internal trauma. The Level 1 in Barrie had a mass casualty event from that pileup on the 400, and they're at capacity. We need someone who can stabilize him for a longer transfer to Ottawa. You have flight surgeons. 2 of them are with the mass casualty event. 1 is en route from Petawawa and won't make it in time." He met her eyes. "He's been asking for you. He served with you. He's conscious, mostly, and he keeps asking for Nightingale." She processed this. "What's his current status?" "BP 85/60 and falling. Altered but responsive. We've got him in the second bird, IV access established. We're managing C-spine, but he's not tolerating the collar." She looked back at the hospital entrance. Holbrook had followed her out. He was standing about 10 meters back, in his white coat, watching. Several other staff members were at the windows. Tatum was at the door. She turned back to Whitmore. "I need my kit, and I need 10 minutes to hand off my patients," she said. "You've got 8. She was already moving. She went past Holbrook without stopping, but she heard him speak. "Quinn, you are still on shift. Any departure needs to go through." "Then start the paperwork," she said. "Colonel Whitmore will provide the authority documentation." She didn't wait to hear what he said next. Bernadette met her in the corridor, already holding Elara's go-bag from her locker. Elara had kept one here, always, force of habit, though she'd stopped examining why. "Old instincts. Tatum's taking your remaining patients," Bernadette said. "I've already started the handoff notes. Thank you." Bernadette looked at her for a moment. "Nightingale?" Elara took the bag. "It was a long time ago. Apparently not that long." She almost smiled. "Apparently not." She was in the helicopter 4 minutes later. Sergeant Major Tran Min Duck was 44 years old and enormous, a former combat engineer who'd done 3 tours and come home and immediately started teaching reservists so they would not make the mistakes he'd made early on. He was strapped into the stretcher with C-spine precautions that he was fighting in a quiet automatic way that told Elara his brain was doing that post-TBI thing where it rejected restraints on instinct. She sat down next to him and put her hand on his arm. "Min Duck," she said clearly, at normal volume. Not loud. "It's Quinn. I'm here." He turned his head, slowly, carefully, the collar limiting it, and found her face. His expression, through the pain and the confusion and the concussive fog, did something complicated. "Nightingale," he said, like it was an answer to something. "Yeah," she said. "Okay, let's see what we're working with." She was already running her assessment, hands moving, eyes moving, pulling information from the monitors and from what his body was telling her directly. The IV was good. The collar was the right call, but he needed repositioning. His BP was the problem. Whatever was happening internally was progressing. "What's your pain?" she asked him. "Abdomen," he said. "Right side." She palpated carefully. His response was immediate. "Okay," she said. "Okay." She looked at the flight medic, young, maybe 26, doing his job correctly, but watching her with the particular focus of someone who knows they're in the presence of someone operating differently than they are. "We need to manage that pressure," she said. "He's got internal hemorrhage, almost certainly hepatic." "How far to Ottawa?" 47 minutes. She did the math. "Then we're going to keep him here for the next 47 minutes. His pressure stays above 80 or we divert to Hamilton." "Understood. And take the collar off." The medic hesitated. "C-spine is clear," she said. "His mechanism of injury doesn't support cervical fracture, and the collar is fighting his airway management. Take it off." A beat. He looked at Whitmore, who was in the forward seat. Whitmore said, "You heard her." The collar came off. Min Duck's whole body shifted, settled, the unconscious relief of a body no longer fighting its own equipment. "Better?" Elara asked him. "Yeah," he managed. "Better." She worked the flight to Ottawa without stopping. The freezing rain had followed them east, and the Griffin moved through it with the particular indifference of military aircraft that don't get to be delicate about weather. She talked to Min Duck the whole time, not about his injury, not about the pain, not about the monitors. She talked to him about Meaford, about the training base, about a staff sergeant they'd both served with who'd retired to Collingwood and was apparently running a very successful ice fishing operation. She talked to him about things that were true and grounded and real. Because the brain in the early hours after a traumatic event needs true and real, needs an anchor. His pressure held. It didn't climb, but it held. When they landed at Ottawa Civic, the trauma team was waiting, and she gave the handoff in the tight, precise format she'd learned before she'd learned anything else. Mechanism, timeline, intervention, response. What to watch for. The trauma surgeon listened and nodded and asked exactly 2 questions, both of which she answered, and then moved immediately on what she'd told him. She stood on the helipad in the January cold, after they'd taken Min Duck inside, and she stood there for a moment, with her hands at her sides, and her face turned up into the wind, which was the wrong direction for weather, but right for something else. Whitmore came and stood next to her. "He's going to be okay," he said. It wasn't a question. If the surgeon moves on the liver in the next hour, yes. I've seen you be wrong about that maybe twice in 7 years. Twice is twice. He was quiet for a moment. "You're at Lakeridge now." "Yeah, how is it?" She thought about Holbrook, about the break room, about the particular silence that had followed. Limitations were working around. "It's a good unit," she said. Whitmore looked at her sideways in a way that said he understood the diplomacy in that sentence and was not going to push on it. "The RCAF Medical Directorate is rebuilding the reserve training program," he said, "for medical technicians. They need experienced people to run scenario-based training, not deployment, not field, classroom and simulation, CFB Borden, 14 weekends a year." He paused. "They've been trying to find you for 6 months. She turned to look at him. "We didn't know you were at Lakeridge," he said. "You were. You went quiet after your release. We had an old address in Sault Ste. Marie." He said it without accusation, just fact. "Today we needed someone, and your name was the first name, and it turns out you were 40 minutes away." She was quiet for a long moment. The wind moved across the helipad, and the city of Ottawa was gray and enormous below them, and somewhere inside the hospital a surgical team was fixing what she'd kept together across 280 kilometers of winter sky. "Send me the information," she said. "Yeah? Send me the information." She looked back toward the helipad entrance. "I should call Bernadette. Let her know I'm going to need a return transport." She walked back into Lakeridge Regional at 2008 that evening, which was over 2 hours after her shift had technically ended, in the same scrubs she'd left in, which now had a smear of something she wasn't going to examine closely on the left sleeve. The trauma unit was quieter now. Second shift. The overhead lights had gone to their evening dimmer. The sound was different, lower volume, more deliberate. Holbrook was still there. She hadn't expected that, but somehow she wasn't surprised. He was at the nursing station with a chart, and when she came through the doors he looked up, and for the first time since she'd started at Lakeridge, his face was doing something she didn't have a previous reference point for. She went to the station to collect her things. "Quinn," he said. She looked at him. "The Adeyemi patient." He said it carefully. "She's out of surgery. They confirmed internal hemorrhage, hepatic and splenic involvement." He paused. "Your timeline in the chart was..." He stopped, started again. "The flag was accurate. The intervention window you identified was accurate." She waited. "The Korhonen documentation from 6 weeks ago." He said this part looking at the chart in his hands. "I reviewed it after you left. Your notation of early decompensation indicators was..." He seemed to be choosing words with great care. "Accurate." "I know," she said. It came out quieter than she intended. He looked up. "I made assumptions," he said, and she could see what this cost him. Not the saying of it, but the having arrived at it. About what your experience meant, about what it was worth in this context. He was quiet for a moment. That was a clinical error, not just. He made a gesture, not just professionally, clinically. It affected patient outcomes. She held the strap of her bag and said nothing. Colonel Whitmore called the chief of medicine, Holbrook continued. Not to complain. He called to ask whether the hospital was making full use of thee. He almost smiled, and it was a strange, small thing. He called to ask whether we knew what we had. Tatum, at the far end of the station, was doing an absolutely heroic job of pretending to look at her screen. Did you get the patient to Ottawa? Holbrook asked. Yes. He should be out of surgery by now. You stabilized him in flight. The team stabilized him. He looked at her for a moment. Then he nodded, once, slowly, which was perhaps the only version of apology available to him at this particular stage of the conversation. And she understood that. She understood the limits of what people can do in a single evening. And she decided it was enough for now. I'm going home, she said. Bernadette has my contact. I'll be back Thursday. She walked to the exit. Tatum caught her just outside the doors in the vestibule, where the wind came in sideways every time someone opened the outer door. Are you okay? Tatum asked. Elara looked at her. 24 years old, earnest, 3 months into trauma nursing, learning what this work actually was. I'm fine, Elara said. What happened? With the helicopters? With what was that? Elara considered this. You know how sometimes, she said. You do the job for long enough that the job knows you back? Tatum blinked. I think so. It was something like that. She pulled her jacket tighter and pushed through the outer door into the January air. Get some sleep, Tatum. You've got a double tomorrow. She walked to her car through the freezing drizzle, and she didn't hurry, and her left leg pulled its slight complaint with every step, and somewhere to the east of her, on a runway in Ottawa, 4 Griffin helicopters were being refueled for the return flight. She got in her car, sat for a moment in the dark. Then she pulled out her phone and sent a message to a number she'd kept for 3 years without using. Send me the Borden information. Quinn. She drove home through the wet, dark streets of a city that had, improbably, on a nothing Wednesday in January, remembered her name.